Hello, my name is Krista Bingham, and I've been an RN for 10 years with 2 years travel experience in Level 1 trauma centers in Atlanta. I'm currently an ICU RN in a local rural hospital. I'm here to talk about the image of nursing in popular culture using the peer-reviewed article published in the Journal of Advanced Nursing on May 26, 2013, entitled The Nursing Profession, Public Image, Self-Concept, and Professional Identity, a discussion paper by Yvonne Hoove, Gerard Jansen, and Petrie Rudbull. The media saturates the image of nursing in popular culture with misconceptions, for better or worse. The image of nursing is determined by how nurses themselves and the public perceives nursing. Earlier studies have indicated that the public image of nurses often differs from nurses' own image of nursing. This image is predominantly based on misconceptions and stereotypes, which find their origins in distorted images of nurses in the media. The media plays a part in perpetuating the stereotype of the nurse as angels of mercy, the doctor's sidekick, battle axe, and sexy nurse. Regarding popular culture's impact amongst healthcare professionals themselves, nursing was and mostly is still portrayed as a female profession, with nurses playing supporting roles to physicians. Thus, nursing is still portrayed as occupying a subordinate position regarding decision-making and delegating tasks. The media often depicts nurses working at the patient's bedside and performing repetitive and routine tasks, mostly as the doctor's handmaiden. This only reinforces the traditional role and image of nurses as an oppressed group. The dominance of the oppressor, in this case the physician, marginalizes the oppressed group and may lead to the development of low self-concept, which can in turn lead to negative self-presentation. Medical or male dominance still permeates the core perception of nursing, even amongst nursing themselves and other healthcare professionals. This study notes previous studies on this subject that indicate that nurses have always been strongly aware of their subordination to the medical profession and are still experiencing high levels of dissatisfaction with their professional status. This undoubtedly can affect career and workplace satisfaction of nurses and other healthcare staff, and ultimately hospital and patient satisfaction. This leads to the subject of nursing stereotypes' impact on patients themselves. According to this article, if patients form negative or misconceived perceptions of the nursing profession based upon misguided information, this may hinder communication and interpersonal relationships between the nurse and patient, which will ultimately lead to poor patient outcomes and mistrust in the community. The previous and current image of nursing in the media still falls short regarding its impact on the public. Worldwide, nurses have developed themselves into professionals with a great deal of knowledge, as witnessed by the development of nursing protocols and guidelines. Despite these developments towards professionalization, previous studies on this subject have shown that nurses are not given due recognition for the skills they have by general audiences. The public should be able to identify with nurses and the work they do. In the media, nurses are hardly seen as professional advisors or experts. The essence of nursing is not always clear, and nurses still suffer from stereotypes. According to this article, nurses see caring for patients as a core value in nursing practice. It is important to demonstrate to the public that this entails more than just sitting by the patient's bedside, as portrayals of nurses in the media would sometimes lead the public to believe. While the image is not obviously negative, it does not incorporate a true and complete concept of nursing, which compromises the professionalism that nursing has struggled for. The virtuous imagery used when describing nurses as angels disregards the critical thinking skills and knowledge base that is required for nursing. Nurses are generally prized for their virtues, not their knowledge. Nurses are not depicted as autonomous professionals, and the public is not aware that nowadays nursing is a theory-based and scholarly profession. Moreover, nursing is seen as a profession with limited career opportunities, and that the characteristics of nursing are incompatible with the characteristics of an ideal career. It emphasizes nursing as a vocational calling and stresses the importance of self-sacrifice, perpetuating an atmosphere that nursing work must involve long shifts, increased workloads, and high stress with limitless amounts of acceptable sacrifice. Today's nurses try to gain recognition for the importance of caring in a society where caring is undervalued. Nurses are viewed by the public as feminine and caring professionals, but they are not recognized as leaders or independent healthcare professionals. To the public, the most important requirement for becoming a nurse is to be able to care for others, not to be technologically adept, critically think, or acquire a vast amount of pharmacological and clinical knowledge. Although nurses see themselves as well-trained professionals, the public still sees nursing as a low-status profession that is subordinate to the work of physicians, does not require any academic qualifications, and lacks professional autonomy. The public is oblivious to the different levels of education and professionalism involved in nursing. Even though many believe that education is important for becoming a nurse, the majority does not have a clear conception of the meaning and practice of the nursing profession. The American Nurses Association has established standards of nursing development and practice that guide and direct the professional performance of every nurse. Each nurse is expected to conduct themselves by these standards with the purpose of improving patient outcomes and community health. The Provision 5 of the ANA Code of Ethics for Nurses states, "The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth." Media's portrayals of the nursing profession are hindering the recruitment of new nurses and growth of this profession. According to this article, it is important that nurses be highly skilled, autonomous professionals that are dedicated to the development of nursing theory, nursing research, and nursing practice. Nurses need to raise public awareness about the various roles and opportunities both basic and advanced nursing practice have to offer and achieve them themselves. Provision 6 states that the collective and individual responsibility of nurses to establish, contribute, and maintain the ethical environment of the work setting and conditions of employment that are conducive to safe, quality healthcare. One component is the ethical duty to respect the worth, dignity, and human rights of all individuals with whom nurses interact with in the workplace. This article states that a negative public image may challenge nurses to look for successful strategies to improve their self-concept and to show their invaluable contribution to the healthcare system. It is our duty to maintain ethical standards in our behavior and workplace that will only attract positive attention to our profession as role models for the future of nursing. Negative perceptions can be overcome with guidelines that have already been provided by the ANA Standards of Practice. Nursing is a challenging and fulfilling profession that has undergone many changes since its inception and will continue to transform the face of healthcare while in pursuit of its identity. This article has opened my eyes to the issues of invisibility and lack of voice my profession has in the media, and I support the author's suggestions on how to overcome that to engender a more realistic perception of nursing profession in the future. Thank you.